Hey Christina, so for the lab video, I have the diagnosis of Wernicke-Korsakoff, and so I decided she would just have Wernicke-Korsakoff syndrome and not encephalitis. The scenario is she's a 50-year-old female that's been drinking heavily for the past 25 years, presented to physician with complaints of forgetfulness, talking irrelevantly, and the last year and a half, a history of falls. Patient was diagnosed with Wernicke-Korsakoff syndrome and is being placed on a thiamine treatment. Patient was sent to physical therapy with orders for eval and treat for ataxia, decreased endurance, and decreased lower extremity strength. We have been seeing this patient for 4 weeks now and are reevaluating. So to start off the treatment, I'm going to go ahead and take her blood pressure, heart rate, because with this syndrome, they tend to have decreased blood pressure with an increase in heart rate. So I just want to make sure it's within a normative value so I don't injure my patient during treatment. So with her just sitting here, I'm going to come over here to the left side and get you to roll that up for me, if I can do that for you. Thank you. My hands are just a little cold. Go ahead and take her blood pressure now. And as mentioned, her blood pressure would be a little high, or a little low. Sorry, her blood pressure would be a little low, but still within a functional value that I could proceed with physical therapy. And we would just continue to monitor it throughout our entire evaluation and examination. So then I would go ahead and take her heart rate. We would take it for the full 60 seconds, just because I would not want to miss anything. And then, like I said, her heart rate would actually be higher than her blood pressure. So, we're going to go ahead and say her vitals were fine. They were within treatable measures. And then from here, I'm just going to go ahead and do some light touch sensation. Because with Wernicke-Korsakoff syndrome, they sometimes develop peripheral neuropathy, and I just want to see where that is at this moment. So we're just going to do a brief light touch sensation check. So we're going to go over the T5. Well, does this feel like this? Yes. Does that feel like that? Yes. Does that feel like that? Yes. And does that feel like that? Yes. Good. Okay. I'm going to go down and I'm going to test your legs now. Does that feel like that? Yes. And does that feel like that? Yes. Yes. Okay. And then I'm going to test the bottom of your feet here. Just relax for me. Well, your shoes would be off. Go ahead. I would take her shoes off for this. That's fine. And then I would test. Take both off. Does this feel like this? Yes. No. Okay. So that would mean that she's beginning to show the signs of peripheral neuropathy. So that would be something we would take in mind, and we would educate on during treatment. It would be an intervention to educate her on proper footwear and then how to check her feet to make sure she doesn't develop any infections because she can't feel her feet the same like she used to be able to. From here, we're going to go ahead and check her reflexes. It's also shown with Wernicke-Korsakoff that they have decreased DTI, especially in the lower extremities. So I'm going to go ahead and test if you're relaxed for me. Pretend that didn't happen.